evening, everyone. On behalf of the Integrated Health and Wellbeing Council, I welcome all of you to this Kidney Care Talk Show, which is an initiative powered by RG Hospitals. I am your host, Dr. Behjat, and today we'll be discussing about holistic approaches to prostate health, integrating medical, lifestyle, and psychological factors. And to discuss about this very pertinent issue, I am joined by Dr. Harban Singh, who's the Medical Director and Chief Urologist at RG Stone Hospital. Welcome to the discussion, sir.
Thank you, Dr. Behjat. First, at the outset, I would like to thank IHW for inviting me for this discussion. And
it's a pleasure, sir. So without further delay, we'll just start the discussion with sir. So when we talk about the typical symptoms of prostate issues in general population, what are the symptoms that they have to, especially men, have to look for when it comes to prostate health?
Let me first start with this, that most of the people, they don't know what is prostate. And what I see in my practice, many patients, they come that, Doctor Sahab, mere ko prostate ho gaya hai. Actually, if we see that prostate is not a disease, prostate is a normal organ. It is a part of our reproductive system. And this is normally found in all males. Now, in lifespan of a male, prostate at different ages has a different function and a different pathology, which gives the different symptoms at different stages. So I will just share one of the slide that what is actually prostate. Prostate hota kya hai? I will start with this thing that first we should a little bit understand that what is prostate. So here you can see in this, prostate is a gland. It is a gland situated around the initial part of our urethra. ये bladder है जिसमें urine kidney से आके collect होता है, and then we start passing urine through this urethra. And इस beginning में, tube के इस beginning में, this is called urethra, there is a gland situated around this urethra is known as prostate. And the function of prostate is it produces certain enzymes and other secretions which is required for the reproduction. So it keeps the sperms healthy in the semen and it requires for the proper functioning of the semen. So prostate is an organ of reproductive organ, but it is situated in the around the urethra. So anything affecting the prostate will affect the urinary system. So as Dr. Behjat asked me about the symptoms, a healthy prostate does not give rise to any problem, any symptom. Now what happens in the prostate after around at the age of 40, there are certain changes happening in the prostate. These changes leads to enlargement of the prostate. And this enlargement can reduce the caliber of urethra. जब ये prostate enlarge होता है, तो urethra के caliber को affect कर सकता है, and once urethra caliber is narrowed, तो urine निकलने में difficulty आनी शुरू हो सकती है. अब second चीज मैं यहाँ पे highlight ये करना चाहूँगा कि nowadays because ultrasound is readily available and most of the people they are going for ultrasound for health checkups or for certain diseases, and उनको report में लिखा मिलता है enlarged prostate and they get panicky. So I want to say यहाँ पे कि don't get panicky if ultrasonologist is writing that you have an enlarged prostate, because after the age of 40, most of the males, they will have some amount of enlargement of the prostate. So two things. One is that prostate is a normal organ and its a little bit enlargement is not worrisome. अब जब प्रोस्टेटिक enlargement इतना ज्यादा होता है कि वो हमारे यूरेथ्रल ल्यूमन को नैरो कर दे and person starts feeling a poor stream. So सबसे important symptom है poor stream. The strength of stream slows down, and it takes long time to pass urine. That is the point when we say that this enlarged prostate is now causing bladder outlet obstruction, because prostate is situated at the bladder outlet. So we should understand that all prostate enlargement will not give rise to bladder outlet obstruction. So अगर आपका prostate थोड़ा सा अल्ट्रासाउंड पे enlarged भी है, but आपको वो urinary symptoms नहीं दे रहा, nothing to worry for that. Now, if person starts having the significant obstruction, initially what happens that bladder becomes hypertrophied. Bladder increases its strength. हमारा bladder थोड़ा strongly contract करने लगता है, and initially we don't feel any problem in the urination. But later on, we will find that our stream is slow. It is taking long time to pass urine, and we feel that some amount of urine is left in the bladder even after passing the urine. So ये तीन चीजें, slow आना, धीरे आना, रुक रुक के आना, और ऐसा फील होना कि कुछ यूरिन बच गया है, एंड लेटर ऑन बार बार यूरिन का आना, यूरिन के कंट्रोल कम होना की एक फीलिंग हुई, अर्ज हुई कि नाउ आई हैव टू पास यूरिन, एंड now person has to rush to the toilet to pass urine. That is called urgency. So later on, these symptoms of frequency and urgency, रात को बार बार उठना, all these may be because of enlarged prostate. Now, even without prostatic enlargement, अगर हम देखें बहुत सारी फीमेल्स में भी ये सिम्टम पाए जाते हैं जिनमें प्रोस्टेट नहीं होता, पर्टिकुलरली फ्रीक्वेंसी, यूरिन का बार बार आना, रात को उठना, यूरिन कंट्रोल ना कर पाना, ये फीमेल्स में भी होता है जिनमें प्रोस्टेट नहीं है. जो पैथोलॉजी फीमेल में ये सिम्टम कर रही है, दैट इज द ब्लैडर डिस्फंक्शन. The almost males also have this similar problem, that they can have a bladder dysfunctions, bladder overactivity, जिसमें कि similar urinary symptoms होते हैं, can be without prostate enlargement. So as a whole, when we club all these symptoms, we call them lower urinary tract symptoms. And lower urinary tract symptoms, जिसमें मैंने अभी आपको सारे ये symptoms गिनाए, ये symptoms, it can be because of prostatic enlargement, or it cannot be because of prostatic enlargement. It may be because of other pathologies in the urinary system. So overall, if person has lower urinary tract symptoms and the person is above 50 years of the age, most of these people, they will have enlarged prostate, and symptoms are because of enlarged, unless until proved otherwise. So they should consult a doctor who can differentiate between symptoms caused by enlarged prostate or symptoms caused by other causes of urinary tract, जो कि prostatic symptom की तरह होते हैं, but they are not caused by prostatic enlargement. So इन symptoms के साथ अगर किसी को problem इन symptoms से है, तो they should consult a doctor who can do certain tests like ultrasound and uroflow, and with those tests he can differentiate that these lower urinary tract symptoms are either because of prostate or there is another reason.
Yes, sir. When we talk about the risk factors associated with it, you have already talked about how advancing age is one of the major risk factors. What are the other risk factors that men need to be wary of?
As far as prostatic enlargement is concerned, this is a aging process. As we know that there are certain aging characteristics in our body, like development of cataract, बालों का सफेद होना, all these are simple aging processes. Similarly, most of the people, they will have enlargement of the prostate, and normally around 40-50% by the age of 50, they have some enlargement, and this incidence goes on increasing, and by almost 80 years, 80 to 90% of the males, they will have enlarged prostate. it is multifactorial. It is not because of some one reason. Earlier, it was thought that it is purely aging process, but now with the better understanding, we know that there are certain other causes, other reasons, which can either initiate the enlargement or it helps in progression of the disease. So the risk factor as such, if we see that nowadays, we think earlier it was thought that it is a non-preventable disease. Yes, still it is mostly heritable. It is related to genes that there will be certain changes, but the progression is we can identify certain risk factors which helps in further progression of the disease. Now coming to those progression factors, it is nowadays most of the diseases are linked with the chronic inflammation. The chronic inflammation happening in the body because of most common is metabolic syndrome. The metabolic syndrome means obesity, dyslipidemia, glucose intolerance, hypertension. These things, they lead to chronic inflammation in the prostate, and this chronic inflammation in the prostate releases certain cytokines which affects the growth of prostate, which affects the apoptosis, by which naturally the cells they die is affected. And once this is affected, the cells which should go into senescence, which should go into death, they are not dying and rather they are multiplying. So most important thing is a healthy diet and exercise. It has been seen that those who are not obese, plus those who do regular exercise, those who don't have a sedentary lifestyle. And this was seen from one study where they found that the people in the rural area, they have less incidence of lower urinary tract symptoms and prostatic enlargement as compared to urban people. So there are certain differences between the rural and urban population regarding the lifestyle. And amongst them is the more physical activity, less fat diet, the people who are obese, people who take a lot of high fat diet, those who take less vegetables, less fruits, it has been found that they have little higher chance of progression of prostatic enlargement, and they can develop, they may require surgery more commonly.
So you have talked about how lifestyle, and of course, which was my next question, how diet helps. So you've already answered that. Coming to the role of stress, because most of the problems that we see today, from hypertension to diabetes to strokes, stress is a major factor. What about prostate health? Does stress also play a role in that, or?
Good question. First of all, as I mentioned earlier, that lower urinary tract symptoms, which we feel is synonymous with the prostate. Actually, they are not synonymous. Now, if we see the part of stress in the lower urinary tract symptoms, there is a significant correlation between the lower urinary tract symptoms and stress. I will just give you an example. I usually give this example to the patients. जब कभी भी पहले, when you go to the examination hall for any paper, so you must have seen that people usually, they go to the toilet quite often, and those who are going to the movie in 3 hours, they will not go to the toilet and they will enjoy. So this is the stress during the examination is releasing the adrenergic hormones in the body, and that affects the contractility of the bladder. So this urinary symptoms, they are definitely, the stress plays role there. On the other side, the stress is linked with the chronic inflammation. As I said, that it is not purely genetic heritable disease, which was earlier thought. There is a significant amount of chronic inflammation, either because of infection or because of metabolic syndrome, or because of these stress factors, they lead to changes at the cellular level where they affect the growth of the prostate stroma and epithelium. So the stress directly or indirectly in both ways affects the symptom as well as prostatic enlargement.
Sir, coming to the preventive aspect, when we talk about screening recommendations, at what age should individuals go for screenings? And how many screenings per year? How does that go?
Now, we just discussed about the prostatic enlargement. जो मैं अभी तक हम लोग बात कर रहे थे, that was a benign enlargement I was talking about. This benign enlargement is quite common, but some patients, some people, they develop prostate cancer in their prostate. These two are totally different entities, two different diseases. Benign enlargement of prostate, what we call BPH or BHP, is just an enlargement which is not malignant. It will just produce the obstruction in the urethra, leading to the symptoms because of obstruction. On the other hand, in the prostate, there can be initiation of prostate cancer. Again, prostate cancer, it is age related, that with increasing age, there is a higher incidence of development of the prostate cancer. But nowadays, this has been seen that obesity, high fat diet, metabolic syndrome, smoking, they can affect the patient in such a way that there can be initiation of prostate cancer. So whenever patient comes to us with the lower urinary tract symptom, and we do investigate and find that patient has a prostatic enlargement, the next step is we always rule out prostate cancer in them. To rule out prostate cancer in such people is done by two things. One is digital rectal examination, where we put a finger into the rectum and feel the prostate. From that investigation, we can see that whether prostatic enlargement is suggestive of benign enlargement or whether it is giving the feeling that it is malignant or a cancerous. And at the same time, we do one test, PSA, prostatic specific antigen. This is one enzyme which is secreted by the prostate into the semen. But whenever it is being produced and secreted, some part of this enzyme goes into the bloodstream, which we can detect by doing the blood test. अब blood stream में जो ये PSA होता है, that is normally in a healthy male with or without prostatic enlargement. It is on the lower side, usually below the 4 nanogram per ml. Although that range is also age specific, so once patient has got it done, he should consult the urologist who can see whether that level of PSA is correlating with the patient age or the prostate size or not. But if this PSA is on the higher side, above 4, particularly beyond 10, then it raises the suspicion that one can have prostate cancer. I'm not here clear. I'm not saying people should not take it in this way that a PSA level of above 4 is suggestive of cancer. No. This is just a border. We take a cutoff beyond 4 also. बहुत सारे patients जिनका prostate is quite large, उनमें PSA level can be even higher than 4. So leave it to the urologist to decide whether this PSA is correlating with the cancer or not. But just to inform the people that there is a screening investigation, PSA, available. One should do in all those people who are symptomatic for alerts and coming to the doctor. Doctors always do the PSA. And once PSA is found in the normal reference for that patient, we say that it is a benign, and such patients, they are put on the medical treatment for the prostate, or they are kept on watchful waiting, and then yearly evaluation by digital rectal examination and PSA is done to rule out that they have not developed the cancer in that year. On the other hand, those who don't have symptoms, even those patients, those people, they should get PSA checked every year after the age of 50. Because in the initial part, the prostate cancer is not symptomatic. Prostate cancer gives symptoms when it has become almost metastatic or it has spread beyond the prostate. So initially there is no symptom. So इसलिए patients जिनको symptom नहीं भी हैं, after the age of 50, as an annual health checkup, they should do a prostate specific antigen. Those patients जिनकी family में there is a history of cancer in the father, they should do this estimation of PSA at the age of 45. So they should do it annually after the age of 45. Otherwise, for those people who don't have any family history of prostate cancer, they should do it after the age of 50 every year. और जिनको symptoms हैं, when they will consult the urologist for their symptoms, it should be done at that time first and later on every year. So these two diseases are totally different. Prostate cancer incidence is, as compared to BPH, it is low, but because it can lead to significant morbidity if the cancer goes to different other part of the body. So one should be careful, because there is only this cancer which can be diagnosed by PSA almost 10 years before it causes symptoms. So we are blessed that there is one test which can diagnose most of the prostate cancer by a simple blood test. So one should be always aware that there is a test and it should be done after age of 50.
Right.
Pardon me, you're not audible.
Can you hear me, sir? Yes. So when we talk about prostate gland, what functions apart from reproductive functions? Because when you touched upon cancer, how prostate cancer, and even in some cases, the gland is removed, when patients have prostate cancer. So apart from reproductive function, what other functions does the prostate gland do in our body?
Nothing other than reproductive organ. This is basically in the reproduction, the sperms are produced by the testis, but for the survival of the sperms, they need the micronutrients, and these micronutrients, they come from seminal vesicle and prostate. So prostate gives certain micronutrients and enzymes which is required for the sperms, which is required for the function of the sperm, and particularly there is liquefaction for the pregnancy. The semen has to first get the liquefied, and then these sperms, they move and reach the uterus. So for the liquefaction, the enzymes, but serine, we call it serine proteases. The PSA is one of that enzyme. So it is required only for reproductive system. There is no other role of prostate in our urinary system.
Thank you, sir. Any other thing that you feel we might have not discussed in the course of the conversation and you feel is important enough to be discussed?
I will, from the lifestyle modification point of view, and I will further elaborate few things. See, once we say that a holistic approach for the prostate, I will not say the word used holistic approach for the particular organ. The holistic approach is for the whole body. And now most of the diseases, we see that there are some interrelation. The most common cause of mortalities is coronary artery disease, cardiovascular diseases. And most of the studies done on the lifestyle modification are for those patients who have these cardiovascular diseases. And once these patients, they were followed up, after the lifestyle modification, it was found that many other diseases, the incidence of those diseases came down in these patients. So from that, we learned that it is the lifestyle modification does not affect one particular organ, it affects the whole body. Now, in these lifestyle modification, the heart takes the precedence. The heart is, so we say that anything if we do for the healthy heart, so any lifestyle for healthy heart regimen, it will definitely affect the whole body, because the metabolic syndrome and all chronic inflammations which are causing the coronary artery disease, almost similar mechanisms. They are active in prostate, causing enlarged prostate. They are active in the erectile dysfunctions. They are even for the mental health. So everything is interrelated. Now coming to healthy heart, the many people, they just believe that okay, jinko heart diseases, only these people should follow that dietary restrictions and guidelines. It is not so. Overall, for male health, whatever we have learned for the healthy heart, it translates into the healthy prostate, it translates into the healthy other organs. So most important, we should all be aware of that physical exercise, yoga, those things are very important. It has been seen that a 30-minute exercise every day reduces the risk of prostate cancer. It reduces the risk of surgeries requiring for enlarged prostate. Similarly, one should be aware of their cholesterol level, because one lipid profile, it makes the person aware that how much healthy life he is living. So simple, for the healthy diet and exercise, the lipid profile is a reflection of that. So I usually recommend to my patients, whenever they come for the prostate, they ask me for the dietary precautions. I said, keep an eye on your weight. Your pant size should not increase. Keep an eye on your lipid profile. You should have a high HDL, low cholesterol, because indirectly it is reflecting that what is your dietary pattern. High non-veg, particularly red meat, it is one of the causes of chronic inflammation. And this chronic inflammation is responsible for many cancers. In the prostate cancer, it was seen that those who were diagnosed with the prostate cancer, and after the treatment, if they followed a healthy lifestyle pattern by increasing the activity, reducing the cholesterol, increasing the vegetables, the recurrence rate was low in those patients. They have less progressive disease. So indirectly means the same thing will translate even in prevention. Although studies till now, because it is very difficult to do a large study prospectively with dietary modifications, it is not easy to do so. But indirectly, we get the evidences from these studies that if some disease progression, recurrence can be reduced by dietary modification, a healthy lifestyle, it will prevent also. So one should be aware, adding certain things in the diet like nuts, flaxseed, all these things, they reduces the oxidants. So oxidative stress is one thing which in the later on in the life gives rise to many diseases. So overall, a healthy diet, I'm not saying that one should one should eat the exotic, costly vegetables or fruits. One should stick to what is available, easily available, fresh, but there should be more. We are blessed in India that our forefathers, what they usually in whole India, I've seen that our dietary in the diet, our diet consists of some amount of pulses, vegetables, whole wheat, grain, and our diet is, in fact, we are blessed with that diet. And most of the studies in the West, they are saying that a Mediterranean diet where there is high fiber, whole wheat, with high vegetable and fruits, they are very helpful in keeping the most of the organ healthy. So one should emphasize on these, not even like the all those micronutrients which are found to be which are available in the supplements like lycopene, or they are naturally available in most of the fruits. This watermelon is rich in the lycopene, easily available. So what the omega fatty acid, all these are available in the nuts, particularly walnut. So one should make the diet in such a way that one should avoid the packaged foods, saturated fatty acids. One should avoid saturated fatty acid, trans fat, the what we use the oil many times by deep frying. Any food prepared by the deep frying have a lot of trans fat in it, and trans fat and saturated fat, they affect this chronic inflammation. So a healthy diet with a schedule of exercise at least 3 times in a week. One should stick to good physical exercise. One more thing which I want to add is the smoking. One intervention, there was one study, the cancer prevention study, where they just asked the people to stop smoking, and the reduction, 5 times reduction in the heart disease and cancer. So one simple modification in the life by reducing the smoking and tobacco, it improves the health of overall all organs.
Thank you, Dr. Harbans. That indeed was a very enlightening session, and I'm sure our audience will take away a lot of relevant information on diet, going back to basics, yoga, natural balance diet. Thanks for being with us, taking out time from your busy schedule and joining us for this session. Thank you, everyone. Thanks to the audience. Meanwhile, you can keep on following our social media pages for more updated information on health and well-being. Thank you, sir. Thank you for being there.
My pleasure, Dr. Vijay.